251. Right. Your thyroid test was good. And they didn't do any more, just this?
My eyes and my. They did my eyes.
Yeah, no, yeah, but that takes some time because we have, if we didn't hear, we send, the picture to the specialist, and they send back, results. I don't expect that you're gonna have any problem in your eyes, you're too young for that. And also, let's see, diabetes. And they accuse you that you snore?
Yeah. Snore pretty loud.
Yeah, probably, you could have some degree of what we call sleep apnea. You don't feel too sleepy next day?
Yeah.
Yeah, that's usually what happens. If we have to drive by ourselves, a long traject, like going from here to San Antonio, Dallas, whatever, we fall asleep.
Mm-hmm.
And the old times that we didn't have any problem myself, I could drive for 10, 12 hours in a day and without having any problem. Right now, if I go by myself to San Antonio, Austin, or Dallas, I have to stop in Starbucks to have a double espresso because it's the only way that I can be awake. Otherwise, I fall asleep. And one time I had an accident. I fell asleep going to San Antonio. I almost killed myself. Anyway, yeah. In general, how is the control of your blood sugar?
When I wake up, it's 130, and when I go to sleep, it's 200.
Not bad. Yeah, the only thing is that the A1C is 9. That is a little bit too high. And that's why you are here, maybe, just to see how we can help you to control this baby. But you never use insulin before, just the medications, the oral.
Right.
The Onglyza and the metformin. Okay, nice. That is a minimum. And the metformin you take only once a day?
No, I take, once a day, but I take 4.
4 at one time?
Yeah, 4 one time.
Okay, indeed. No, that is one tablet once a day, they say. The metformin, but it's 4 tablets. And you don't have diarrhea with that?
No.
When metformin, glucophage came, into the picture of medicine here in the United States, I started taking myself because I was pre-diabetic at that time. I started taking 3, and I had diarrhea, with 3. I had to cut down to 2. But if you're doing fine taking 4, it's no problem. You could take 2 of the 1,000, but if you're used to take 4 of the 500, okay. Any problem handling your weight?
It stays at 220. 220, 230, 220, 230. It doesn't go over 230.
Okay. Yeah, according to the your relation between height and weight, you are in the border of obesity. And then that is not good because in diabetes we have to be really below that line of obesity. And if you drop weight, that's the only thing you need to control your sugar. And then we can help you with that because you're taking metformin. But if I give you the medication we use for the appetite to decrease a little bit the appetite, not to suppress. And also we are using a medication that is injectable, like once a day. That drops the blood sugar and also the weight. And then if you lose 10, 15 pounds, gosh, that's the only thing you need, Because you are really practically brand new. You don't have complications. You don't have anything in the heart. You don't have anything serious in the eye, the kidney, your nerves. And you have to take good care of this at this point because you're young, and if you don't do it, you're going to suffer the consequences of this. That the main thing for us is impotence. We don't get it up, because the hormone that we produce in the testicle to have the erections drop when you're out of control. And then it's something that we have to pay attention because at your age, you have to be normal in that area. You don't have any problem with that? That you have any?
No.
Yeah, I don't expect that you're going to have any. Where is your name from, Raymond? The Baca is from Spain or from?
That's what I heard. I don't know too much about my history, but that's what I heard. Spain.
Okay, good.
I really don't know my dad's parents.
But I'd like to give you this treatment with these medications that I'm talking to you about. We're going to start with the appetite suppressant in a very small amount. Later on, we can have, the injectable one that I mentioned. Injectable of this kind, we have 3 in the United States. One is called Paera, and that has to be injected twice a day, before breakfast, before dinner. It's connected with the food. But then they came up with this new one that is just once a day, anytime. Very nice. That's the one that we use the most. It's called Victoza. And the third one that they came up with is what we call Bidurion, and it's once a week. It's one injection once a week. But that has its pros and cons, but the main thing is to see if the insurance is going to cover, because they are expensive. Injectable is not a big deal because it doesn't hurt too much. The needles are so small and very sharp that don't give any big pain. And then we're going to leave that until we see all the information that we're going to collect. Probably the best thing that we do to find out how people are with this disease is to check the blood sugars in 3 days in a row. We put a sensor in the skin that measures the sugar every 10 minutes for about 400 times or more. And then with that, we have an idea, fantastic, how your sugars are through the night, through the day, after you eat, after you take the medicine. And it's good, and we call that the continuous monitoring of the sugar, CGMS, Continuous Glucose Monitor System. And we have to keep this for 3 days. We usually set up, putting the sensor in the skin Fridays or Tuesdays, because you have to come back in 3 days. Friday is the most famous because Friday through the weekend, you are not working, it's well taped, you can take, showers and no problem. And that's the best test we have, the CGMS. We're going to set you up with that. Okay. Okay. When was the last time that you had seizures?
Tuesday.
Oh, really?
Yeah, that's what happened to my face.
Yeah. Which one is the medication you take for that?
The Keppra.
Okay, bro. No, they didn't put it here.
Well, is it called something else?
Oh, levatiracin.
Yeah, levatiracin. Yeah, that's it.
Yeah. Yeah, because I want to see. Yeah, it's here. And have you been with Dr. Cantu for some time?
A year. A little bit over the year.
Oh, she's a good doctor.
Yes.
Are you under the care of neurologist?
Yes. He's the one that prescribed the Keppra. Well, he tried to do Dilantin, but that wasn't working.
Didn't work.
It didn't work. I wasn't metabolizing it. It had no effect.
Okay. Any problem with the cholesterol that you had before?
I think it's a little high. I think my cholesterol's a little high.
But you're not taking any medicine?
No. I think it's, yeah, I'm not taking anything for it. I just need to get on that South Beach diet. You know, a lot of greens.
Yeah, that's the best diet in South Beach. We like it on 2480. Your pressure is very good. And you had a recent eye exam? Or you had...
No, I've never had one until today. I've never had any problems with mine.
Yeah, no, in this business of diabetes, we are proactive, you know, doing the things and checking the things before you get sick. Because diabetes has the advantage that we know what's going to happen if you don't do the things right. Then we can foresee and we can go ahead and avoid the problems in the eye, the heart, the kidneys, and all the places affected by You don't have any problem with your feet, do you?
No, just the athlete's foot.
Did my assistant check it?
Yeah, I just have a little athlete's foot.
Yeah. Okay, but you don't come here, let me just check if you're